Going to get going here. Rather than reinventing the wheel with a lot of the interventions, that it's better to shine a light on organizations that are already doing great work. And the best way we can do that is by showing impact. So today's session will really think about how can we measure that impact, how can we evaluate programs in a way that is fair to the program itself, and fits with the existing literature that connects social connection to all sorts of different health outcomes and things that matter to people, right? Our social lives are important in and of themselves. So today we're really fortunate to have some experts in the room. I'll give a couple of quick introductions. The first person we'll be hearing from is Dr. Matthew Smith. Matthew is a professor at Texas A&M School of Public Health. He's an interventionist and evaluator, and his research interests really focus on health risk mitigation and evidence-based solutions for older adults. So he has expertise that bridges a number of different areas. I remember first learning about Matthew's work as it related to just older adults and fall risk. And we were very fortunate to kind of reel him into the social connection space several years ago. And he's really been able to provide his knowledge around healthcare, public health, and aging through a lot of innovative measurement design solutions that really bridge academia and community health, but also really involve community organizations in measurement design, which you'll see. The second person we'll be hearing from is Amber Carroll. She's a senior director of connection programs at Front Porch Community and Services. Amber is an incredibly passionate leader and advocate in the field of aging. She has over 13 years of leadership experience in programs that really center older adults. She oversees the Front Porch Connection programs, which have successfully decreased loneliness and increased meaningful social connection for older adults nationwide. So she is an active member of several local and national advocacy coalitions and organizations, including the Older Adult Working Group here, with the Foundation for Social Connection. And she's really driven these collaborative and scalable solutions to advance equity and accessibility for older adults. I can say as a researcher collaborating with Amber, I've just found that she is incredibly generous with her time and always really mission-driven and her focus on older adults. And the last person we'll be hearing from is Ali Hoden-Bayer. She is the Chief Program Officer at DeRote Incorporated in New York. She directs strategic vision and execution of concrete and supportive services, social connections programming, volunteer visiting, and external partnerships. She leads a team responsible for in-person and remote programming for older adults and volunteers with varying interests and capabilities, the social framework that bolsters DeRote's work, and program impact and evaluation. Ali has worked in aging services for more than 2 decades and previously served as the executive director of the Aging in New York Fund, the philanthropic arm of the New York City Department for Aging, helping the city incubate new programs to meet the evolving needs of older adults. I learned about DeRote just recently and am amazed at how beyond I realized that, well, let me back up. I realized how incredible work community organizations are doing by learning what Ali does at DeRote, and how much we could be doing more for older adults as we connect health systems to community organizations. So I'm really thrilled to be able to hear more from these panelists. Our goal today is to, of course, get their experience, but it's also to involve you all learning as a group about what measurement makes the most impact for your organizations. I also want to make a brief plug for another conference that we'll be having in March in Washington, D.C., where we'll specifically be focusing on measurement, on how to set a national agenda, how to arrive at a consensus for measurement in the social connection space to measure what matters. All right, so with that, I'm going to turn it over to Dr. Smith.
Oh, great, thanks. Okay, thank you. Now, I already have a microphone on my lapel, so I don't know.
No, that's just for recording, so
Yeah,
you
okay.
need that.
Someone should have told me, hey, thanks for making the hike upstairs. Happy you're here and happy we're all together. Thank you for the warm welcome. We really appreciate that. And we're going to talk about things that are practical. So really excited to have everybody here. And just so a little bit about what we will be speaking about, you know, there is an actual initiative that we launched together to be able to identify practical ways to understand how our programs and services impact our clients. And so with that, we're going to provide a very brief rationale and history of how that came to be, give a little bit of an overview of the R-Basic, which is, oh, here's the test, the retrospective brief assessment of social impact and connection, which is why it's called R-Basic, because no one wants to say that out loud too many times. And then also a little bit about the pilot. But then really what we want to hear about the people, or from the people who made it happen. So we would love to have Amber and Allie come up, have a conversation, talk about some of the ways this is useful, some of the ways that we'll utilize it, and of course have you all ask as many questions as you possibly can. So with that said, I think this is pretty common to everybody. So much of this has arisen from the need and conversations that we've had with community organizations. Everybody knows that we do a lot of different things to help our older adults feel more connected, address their loneliness, address their isolation. And they're very unique in what we do. And when we talk about measuring what it is that we do, we know that multiple different measures would be needed to know what it is that's changing. How are we being impactful? But yet, in conversations with community organizations, there's often been an expressed need to have better measures, measures that better help justify what our programs do and what it is that we can say is a value proposition of why we should keep them going. And so with that, we all know the value of data. Data is phenomenal to be able to make programmatic decisions and advance our way forward. But in addition to that, of course, build collaborations in our communities, validate what we're doing actually matters to our clients. But in addition to that, funding. And we always want to make a strong value proposition of why it is that we should support what we're doing. So through these conversations, I've documented some of the things that I hear quite often. And that is, how many of you does this sound like? Anecdotally, we know our programs work, but when we look at our data, we don't really see that it's changing very much. Or we selected some measures, maybe because we were told by a funder, maybe because it was a standard, but yet when we look over time, that has fallen flat. It doesn't really change much, even though we know we're making a bigger difference. Yeah? True? False? Okay. How many are in an organization that maybe it's a little challenging to track longitudinal data, have the people power and the resources to be able to do so, or even if you collect that data, to then be able to analyze it or report it? There's challenges with that. And then, of course, how many of you have started an initiative and not necessarily started the evaluation at the same time point, and so you have to ask questions later? Absolutely. We've all experienced these things. And that's why we really came together to do this initiative. So some of the things that I've heard most explicitly, if pre-test, post-test data don't show changes, how do I know what my initiative actually did? Or we offer these amazing programs and services, but in what ways do they promote social connection? And we don't always have the right answers to those. So a show of hands, how many folks in the room are program people? Offering a program, a service? A lot. How many are funders in the room? Decent number. How many are in the academic space? How many are wearing multiple hats? Yeah, okay. Just wanted to confirm, because that's usually the way it goes. Okay, fantastic. Well, as Ashwin alluded to, part of why we're here today and together is because of the Foundation for Social Connections Older Adult Working Group. And the Older Adult Working Group is something that was established in 2021. And it is chaired by Maureen Feldman, who wishes she could be here but has a phenomenal other celebration in her world that she's attending. But with that said, the tireless work of being able to bring together individuals to focus on older adult issues. The Older Adult Working Group brings together coalition members from the Action Alliance, or the Action Network, excuse me, and brings them together to address common problems and hopefully create common solutions. And this group identified the need to focus on measuring the impact of programs and interventions designed to enhance connections for older adults. That was their charge. Now, I did not know this organization existed. So I was delighted when I was contacted to join one of the monthly meetings. So in 2023, as I'm told, the Older Adult Working Group expressed a need to say, we need additional or better tools that help us measure our program impacts. Some of the things out there are not doing a great job. And with that, they shared this need and expressed this need to the foundation. Luckily, I serve on the Scientific Leadership Council for the foundation, and so they reached out because they knew of some of my other related work. And that's another thing that we'll talk about, but not in depth today. But with that said, I joined in a meeting, and together we started a process. And this process has been going on for a long time, and it's come to fruition, and we've actually learned a lot. So we together identified an opportunity to create a new measure. We identified how to best get institutional review board approval and do an actual study to then engage sites, not only in the Older Adult Working Group, but all across the nation to be able to start testing and piloting. And now we're doing so much of the other work, the data, the analysis. So let's talk about these measures. So there are two measures. As I said, one of them I already had. And that's what I was like, oh, this is going to be easy. I'm going to show up to this group, look at this thing. We're just going to use it, right? That's not how this went at all. Hence, there is the RACI, but there's also the R-Basic. So we went another direction. But the thing about these that are unique, we all know the common measures. What's unique about these are that they are retrospective in nature. They ask about specifically, what did the program or service do in terms of social connection? What opportunities did my program or service give in terms of being more connected? So instead of focusing on the state of loneliness, the state of isolation, what is happening today, this is more about the it, what we offer, the program, the service, and what did it allow us to do? Because we often know if the measures are falling flat over time, it's not that there was an absence of an impact. Anecdotally, we hear all the time that there's impact, but there's a lot of factors that influence social connection. So how do we validate that our program did something, and what did it do? So the first measure is called the RACI, again, the Retrospective Assessment of Connection Impact. It's 13 items, and it looks at aspects of structure, function, and quality. So what did our service do in terms of structure, function, quality? The other is the R-Basic. I don't need to say that again. But it's 6 items, and it primarily assesses function, loneliness, connection, companionship. We'll talk about those. But there are 2 different measures that came together into this national pilot. So both are very easy to administer and pretty quick, but they're very appropriate cross-sectorally. No matter where you're serving clients, it's appropriate. Also across age groups. Even though developed with older adults in mind, it's really relatively universal. And it's really, again, retrospective, but when complemented with pre-test, post-test, can be very, very effective so that we can identify what has changed, but also what our program did. Now, to give you a little bit of an overview of these 2 measures, if you see in this bottom right-hand corner, and I'll read it to you because I know that's small, we are interested in the impact of X, whatever that X shall be. It's a program, it's a service, it's the name of something. Tell us how much your participation has influenced each of these topics, and if any of those topics do not apply to you, please respond with non-applicable. And so we just ask, how much has this program, this service, given you the opportunity to do these things? Wait for it. If you're taking pictures, there's another one that's probably a better picture. The RACI is the longer one. Meet new people, make new friends, interact with people I know, interact with people who are different from me, create a sense of group belonging, maintain my relationships, feel less isolated, I don't need to keep reading. But structure, function, quality, aspects. Yes? I will gladly share I don't know what that mechanism is, but. Okay. I also fixed my badge to anyone who tried it yesterday. So it works. Okay? But again, after participating in this initiative, in this program, in this service, how much did it give us the opportunity for these connection points? Now the R-Basic, here's the better picture. The R-Basic is similar but different. Everyone's like, oh, is it just 6 of those items? It's not. And so with that, how much has it given us the opportunity to interact more with others, create social connections, get companionship, give emotional support, get more socially connected and feel less isolated or lonely? Okay? Now with that, again, structure, function, quality in the RACI, a little bit longer, more function-based when we think about the R-Basic. But this is going to be the focus of where we go. So the RACI is now going to be in the rear view, and let's talk about the R-Basic. Okay? So we did a national pilot. I launched this to engage many different organizations, over 40 different organizations across the country engaged in this pilot. Some of whom did the RACI, some of whom did the R-Basic, some did both. But with that, everyone was charged to identify 50 or more of their clients who have already been receiving their program or service for 3 months or longer. They started 3 months or longer because we wanted to see at least some of the magic. Don't want to be a new person because they maybe didn't necessarily get that service or get that benefit yet. But at least 3 months. Now some could have been a year later. Some started this program and service upwards of 10 years later. It kind of just depends with all of these different organizations. So we captured all of that. The individual who completed this, we wanted to be inclusive, so it could have been the older adult, it could have been a volunteer, it could have been an employee. We had lots of people complete this, but we're focusing on the older adults now. And of course, we wanted to make sure that we included a variety of different programs. So for the R-Basic, there were 7 unique organizations that jumped in, most of which were with the older adult working group, but some were not. There are 12 different unique sites within these organizations that collected data across 10 unique programs. And I will also say that there is still a group that is doing this, sitting in the front row. Meals on Wheels America is also still working on this, because we built it into another initiative, and so it's more data coming. But you can see that we got over 640 responses. So 645 individuals completed this, gave us a great opportunity. And when you look at the programs and you look at the organizations, you can see that many of them were like Friendly Calling. Many of them were virtual communities, virtual programming, but some of them were actually in person. Affinity groups or recreation or educational or, for example, they're friendly visiting. And then there's one called Ditch the Desk, which was kind of getting out of that virtual space and actually getting in person. So a great mix of groups, but primarily social calling and virtual. Okay, so that's what we did. Now very quickly, because I really want to save the time for the true experts here, just tell you a little bit about what it is that we saw. And know that there are many, many different analyses that are still ongoing, so this is very formative. When we look at the different organizations that I just showed you, who contributed data, and of course you see Front Porch and Durot right up front, which is fantastic, and we're going to be hearing from them about their experience and how they're using this information. But you can see that a lot of contributions came in, and just really excited about how that really played out. When we think about the 645 clients that we recruited and were able to serve. Well, actually, they were already served. Remember, they were already served. Don't mean to misspeak. On average, they were about 73 years old. About 80% were female, about 13% Hispanic, about 80% self-identified as being white or Caucasian, about 10% Black or African American, and about 3% Asian. Almost 60% reported that they lived alone. And when we asked these individuals today what was their feeling of loneliness, we only asked one question. You can see that about 56% said that they either somewhat, usually, or always felt lonely. Now, is that because of our program? No. We don't know where they started. That's the problem with retrospective. But this is great information to have, but it doesn't necessarily tell us the whole story, right? But what we're trying to do and what we're interested in learning is, what did we do? So when you look at the R-Basic 6 items, you can see that largely 45 to 55% of clients said that yes, this program, this service helped me and gave me opportunities to interact more with others, to feel more socially connected, to feel less lonely or isolated, create social connection, get emotional support, and get companionship. Now you can see that the largest reported non-applicables, because remember, we want individuals to report non-applicables, and I know that's a point of interest, and also something. Not every program has to do all of these things. Not all of them were designed to do all of these things, and that's what we're trying to learn also. So it's not just understanding our impact, it's more so defining what it does and what it doesn't do. And so that's why this is so informative. And you can see that a decent proportion of individuals said, for example, 10%, they did not think it was applicable that this program or service gave me emotional support. Or about 8% said that it wasn't applicable, that it gave them opportunities to feel less lonely or isolated, which is interesting. But you can see largely from participating in these programs and services, there was a great opportunity to show value in terms of connection. Okay, so with all of that said, I think it's time for the panel, because these are the ones who are really making it happen. Yes, of course.
Can we extrapolate from the data that you collected with regards to the whole population? Like, is it statistically significant enough to make that type of analysis and to apply it in the program? The 645.
So it will be, so it's doing a validation process now. And now remember, each of the individuals, some groups got more than 50 clients per group, but generally speaking, based on the thousands of individuals in similar types of programs, the thousands of individuals who were served by these organizations where we only took a piece, it's suggestive, it's not definitive. Okay. So we're at least going to be able to help validate and make this available where it can be utilized, and therefore we'll learn more when we get more data from more sites. Also, in combination with the RACI, the other, there are another 700 plus who've done this. So taken together, these retrospective measures have reached about 1,500 or more individuals. So it's growing evidence, but it's not exact because of the diversity of the programs and services offered and the types of organizations. Absolutely, I love that. So, coming on up, we have Amber and Allie. I will join them in a second. And Ashwin will moderate this conversation. But I think it's really important that we hear from Front Porch and DeRote about what they did. So, Amber, I turn it to you first.
Hello, everybody. Thanks so much for being here. So I'm Amber Carroll. I'm with Front Porch Communities and Services, and I can give a little organizational overview now. Front Porch is a nonprofit organization based in Glendale, California, and predominantly their focus is housing, brick and mortar buildings. We have 54 communities strewn mostly throughout California. But we also have a number of services and programs that are included that serve both residents of our communities and the outside world. So for this particular pilot, we piloted with what we call our connection programs. Those consist of 3 programs, actually 2 programs at this point. So Well Connected is one program, and that's a virtual activity program for older adults living throughout the United States. So accessible by phone or online, folks are calling into different activities. And this isn't passive engagement. The whole point of the Well Connected programs are really about active, meaningful interaction between people. So we also have a Spanish program, and we can kind of talk more about this rollout in other languages. Right now, we've just administered it to our English-speaking participants and volunteers of the program. And I think of interesting note is the fact that within the Well Connected program, a lot of the participants are the volunteers of the program. So we're really curious to see if there's any differentiation between people who are engaging in multiple roles across one or more programs. The other social connection program that we're looking at is a program called Social Call. That's one of these friendly call programs that Matthew was talking about. So we match an individual with an individual for a weekly friendly phone chat. It's not a clinical program, it really is a friendly calling program. Sadly, Front Porch recently shut that program down, so many of our matches with Social Call were graciously taken on by DeRote, who has similar friendly visiting programs.
Good morning, everybody. I'm Allie Hoden-Bear from DeRote. We're headquartered in New York City, and most of our in-person programming happens on the Upper West and East sides of Manhattan, and then we also have an office in Westchester, and then we have many remote programs that happen across the country since COVID, really. And when we say remote, we mean both phone, and when I say phone, I mean like this phone, as well as Zoom programming. We are a social service organization that's been around we're actually celebrating our 50th year coming up. And our mission has always been to alleviate social isolation through a combination of volunteerism, intergenerational programming, and partnership with the community, their peers, and our staff who interact with them quite a lot. And the touch points that staff give and are designed to provide is really a meaningful piece of how we do our programming at DeRote. All of our programs are free. We offer a variety of different ways for people to touch us and for us to touch them. And no matter whether it's technology or visiting programs or phone calls or lifelong learning, social connection is the name of the game. It is why we do the work that we do. It is the integral piece to our service delivery model. The 2 programs and you'll see a few statistics, we have about 50% of people who are between ages 60 and 79, and an equal amount between 80 and 100 plus. Some of the people who are in their 90s and 100s are more active than the people who are in their 60s and 70s. For the R-Basic, which is the program survey that we chose, we worked with 2 different program models. The first one is a phone-based program like Amber's, or Front Porch's. And that program is designed to initially match one-on-one, match people for 8 weeks with an opportunity to rematch. So really everybody who participated in the survey, because the requirement was over 3 months, are people who chose to continue with the relationship that they had. So we knew that there was a depth, and depth is something that we wanted to measure. The other program is a program that we really don't have enough measurement for right now, our Zoom programming. And all of our Zoom programming is different. People might come for small discussion groups, they might come to learn something with an interactive component, it might be hands-on art. It really varies. And so we've struggled to really figure out how to measure this consistently. So the staff got together and decided that we wanted to kind of term it a virtual community and see the impact of ongoing participation in Zoom programming. So we looked at people, and we have probably upwards of 3,500 people who participate in our Zoom programming each year. We looked at people who had participated in at least one Zoom program for 20 weeks over the 3-month period of time that we are talking about here.
phenomenal context. So I'm going to keep this slide up just so people can waste that. And I will, I guess, sit with everyone else too.
Hello.
Hey. Okay.
That sounds good. So thank you, everyone, for sharing all that information. There's a lot to unpack here. So I think just a little bit of to step back for a second, I was curious if you all could think back to your partnership and how did all of this start? Because Matthew, you mentioned that in 2023 you were brought in to think about this tool. So Allie and Amber, how did you think about the need for a new tool, given the many existing measures that were out there?
Can I do that? Yeah. So at DeRote, we have a director of program impact and evaluation, and we struggle to figure out the right way to measure the impact of our programming because people have different paths. I call it a choose your own adventure, right? Somebody who's participating in Caring Calls might have been a volunteer for 20 years before they participated as an older adult themselves. They may be a volunteer but consider themselves an older adult. They may be an older adult and consider themselves a volunteer. We try to meet people where they are. So their experience and how they show up in our programming as their whole self is really so varied that we struggled to find a tool that was about the impact of the program no matter where they were. And we do, there's a lot of tools out there that organizations use, and rightfully so. We are very concerned about negative language in survey questions, and so we have tended to not use certain questions that are more standardized in the community at this point. The other thing that I would say is that in the last few years, we've received a handful of grants actually on person-centered trauma-informed care, PCTI, and it kind of swung us from feeling comfortable using words like social connection and isolation in our questions to almost veering to the exact opposite. So even though it's our mission, we were not comfortable, or certain staff were not comfortable with executing questions in our surveys that had that language in it, which poses a problem. So I think that the experience here has taught us that there's an in-between, that we can ask the right questions with the right language, but really maybe explain why we're doing so, and educating the person who's answering the questions might make it a better process.
And I'll just add to that. I noticed a lot of hands going up for program people here. How many of you have use any kind of scale at this point? How many are using the UCLA? Okay. So when that came out, and that kind of became the industry standard, and what we were finding a few years ago was that all funders were just kind of arbitrarily throwing, maybe it wasn't arbitrary, but throwing that in to do a pre-test and a post-test, or keeping track of that data over time. And for us, even though it's 3 questions, which seems really simple, like Allie, didn't love the language. It's very medical and clinical and negative. But the other thing is, if we wanted to see that needle move over time, you have to administer that over time. And we, like I imagine many of you in this room, have the problem with capacity to do that. So we kind of set off with this very bold goal of we are going to assess all of our participants and volunteers 3 times a year to kind of align with our well-connected program schedule. We just couldn't do that. It just wasn't possible. So we were really looking for a tool that we could embed in other things. I mean, there's goals to roll this out across all programs. As Matthew mentioned, this is a tool to use for a thing, whatever that thing is. So it's really diverse, and then the hope then is those individual things can add questions of interest, but then we're getting this baseline of how well are we doing what we want to do. The other issue around some of those scales is it's so dependent on timing, right? If you administer the UCLA 3-question loneliness scale on the day that somebody lost their spouse, you could easily turn that around and say, man, my program sucks. Like, we're not doing what we're aiming to do. So that was the big, that was the incentive for us to be on board with this pilot.
Can I add one more thing? As Amber was saying, like, you know, when you're asking questions that are a snapshot in time, it is not about program impact, right? So, and we have different surveys for each one of our programs, and having consistency of certain questions that we can run through the whole agency is very important to us. But when we ask questions, you're not really sure if the person is answering the question about the agency impact or about the program impact or about their moment in time. And the need to have something that really measured specifically this specific program, whichever you chose to use, was new for us and really helpful.
So what I'm hearing is this both helped to address some of the burden in the scales, that just the length of the scales, but also some of the stigma or discomfort that can come with the scales. I know that, you know, as a researcher, some of the National Institutes of Health grants actually require programs to administer the 20-item UCLA Loneliness Scale. So just one domain, you know, you're spending a significant amount of time, and that can be really challenging for a lot of programs. I'm also wondering about the flip side, though. What is lost here when you focus on these 6 items? Kind of how did you make the decision to focus mostly on the functional aspects of our social connections? And how do you kind of address that gap? And this is a question for all of you.
I think this is for you, Matthew.
Well, as mentioned, the RACI was initially presented to this group, and it does have aspects of structure, function, and quality, because we know connection is complicated and complex, and it's different for many different individuals. Now, through the conversation, of course, the initial response was, that's too long, because everyone's collecting their own data. So then we just had a really wonderful iterative conversation. Unfortunately, these were monthly meetings, so the conversation started and ended and then picked back up a month later, and then started and ended and picked up a month later. So it took a bit of time, but through the conversation and really hearing about what was mattering most, or maybe the perspective of the deliverers of what we're offering and what we're probably impacting or changing, things tended to focus on function, that loneliness, that companionship aspect. So we went back and forth a lot. And as a researcher, I would love to just say, do these things. But that's not how this works. That's not community academic collaboration at all. So we almost negotiated. I think this is important. They thought this was important. Let's meet in the middle. And what can we create? And this was the result of that.
That's great. And building on that, how are you all planning to use this tool? How will it inform your evaluation process or how you talk with funders?
So I have high hopes for this tool, and I've been talking to some of our funders about this, and everyone's really excited about what the data will show and how things are rolling out. So, I mean, my big lofty goal is that this kind of becomes the industry standard for programs to use, and because it's so diverse across programs, it can really hit so much. I would say I've been with Front Porch, with the connection programs, for a decade now, and every year, you know, we've been doing evaluation for the last decade, and usually that evaluation process started with us kind of convening at a staff meeting and being like, what do we want to know? What do we think we're doing? We talk to our participants, we talk to our volunteers, what do you think we're doing? So we were really coming up with questions. And I'll shoot back to about 9 years ago, we created an evaluation, and one of the things we were just curious about knowing was, what was the impact on health through participation in the Well-Connected program? And so we threw in 2 questions, not a researcher, right? These were just things I wanted to know. So we asked how the programs were impacting physical health and mental health. And we sort of expected and hypothesized that the mental health piece would be relatively high. But I think something like 67% of our participants said their physical health had improved because of participation in a virtual activity program. This blew my mind. And I called Kaiser and I was like, hey, you gotta fund us because, hey, we're saving you tons of money. And what they said was, that's nice. That's not really research though. So, partnering with gentlemen like these, we've started to get more into the research realm of things and digging deeper into evaluation to really asking the questions that funders want to know. And we in turn are trying to inform funders about what they want to know.
So we tested this tool on programs that are not already, don't already include a survey analysis because we're very concerned about survey fatigue. People might be in 4 different programs. So we didn't test it necessarily with programs that we'd be really interested in comparing our results with others like Front Porch and others in the older adult working group to be able to share across sectors and also missions how we're performing. I hope to be able to do that in the future, and I would certainly, I'm excited to see the results before I say I'll use this forever, but I really have high hopes for what this can do. We use our surveys to do a number of different things. It is not just the pieces that are reflected in this survey. So whether it's program feedback and informing program design, or whether it's asking about the customer service component or how they're actually, we fold in some things about, even if they're not using it, if they see DeRoad as a place that they can turn to for different types of programming. So I'm trying to achieve a number of different things. I see this being a piece of what is probably too long of a survey in the long run that we're using in other places, but that fits a number of different goals of ours along the way. And I have started to fold it into grant reports where I'm talking about the DeRoad's desire to really create a more robust, sophisticated program impact measurement priority for the organization and really build upon the surveying that we do right now to inform other stuff. I also have high hopes of, if there's academic researchers here, really partnering with researchers just in the future. This has proven to me that I don't have to be as sophisticated in order to do it as it once felt it needed to be.
And I'm just going to add to that a little bit. Again, because this can go across different sorts of programs, I have a goal for Front Porch as a very large organization to kind of be able to use this tool. I think for any organization that does multiple different programs and different things, if we've got some baseline questions to ask, really, we're an organization that does housing. We're all about creating community. I could say everything we do is about creating community, which is really about addressing that social connectivity. So if we can utilize this across our housing communities, the wellness programs, the life enrichment stuff, the dining stuff, everything we do across the program, I would love for the organization to use this as a baseline. Because I think for organizations to do that, then you can stand up on that rooftop and shout, hopefully, shout that you're doing exactly what you're setting out to do, that these programs are effective at addressing what you're wanting them to address.
I'm hearing that benchmarking is really important, both internally within your organization when you have many different programs, but also to compare it to other programs nationwide. I'm wondering a little bit about what are the next steps in showing the effectiveness of this tool in showing program impact? Because this is a great first step, kind of capturing the concepts of social connection in an effective way that's specific to the program. What do you all have planned as a next step?
So interestingly, Meals on Wheels America is also part of the older adult working group, and in the Core Client Insights Initiative is looking at service delivery and prioritization and looking at the effectiveness of programs for not only connection, but also for food, nutrition, food insecurity, and home safety. So while we're learning about the effectiveness of these programs, we've also integrated the R-Basic into the post-test so that we can learn more about the services they provided in this regard. So that will now allow us to link pre-test, post-test change relative to the actual it that they received, or even they, because sometimes they get multiple services. So in addition to that, I would like to call out also US Aging. We have a community of practice that we are concluding at this moment that has built in the RACI, so the longer version. And we're also looking at those in terms of the outcomes associated with chronic disease management and what are those types of workshops and programming providing in terms of social connection. So there's a lot of validation, but starting from the beginning, you know, there's also ways, if I can, to take a question that's retrospective like the R-Basic and change the STEM to say, now that you're enrolling in this program, what are you wanting to get out of it? These things. Then at the end, ask these. What did it give you the opportunity to get? These things. And now you can do a little bit of expectation confirmation. I expected to get these things, that's why I wanted to get into it, but did I offer those things? Also, since this is only one snapshot in time, we can also ask these questions again later to see about program drift. Are we recruiting different people? Are we serving different clients? Is the program being administered with fidelity? Are we strengthening our services to get more of the things that we wanted? So there's a lot of opportunity that we're building in.
That's very exciting. So with that, I'll turn to kind of our last portion of the questions, and then we'll start to invite you all to get your feedback. So to kind of round us out, maybe we can just take a step back here. Do you all have any tips when we think about academic community organization or cross-sector collaboration? What went well? What could go better?
Oh, I look at you all.
As a lifelong nonprofit gal, one of my goals has always been within an organization to kind of break down those silos and work together. And, COVID really pointed this out for us. Our current state of the world is pointing this out. We heard about this a lot yesterday, how important collaboration is. I think for me, this has been such a joy of having access to these super smart people who know all these skills that I don't have. Other organizations to partner together, to work together. I think there's been something really unique, and we saw this before the older adult working group, but we certainly see it in the older adult working group. We're all doing sort of similar things, but it's not competitive. It's very collaborative, and how can we do this together, and how can we make this impact greater? So I think back, DeRote and Front Porch go back a long way. We actually replicated a program that DeRote had started 40 years ago, University Without Walls. And when I came on board, we met and very consciously decided, let's work together. Like, if people have access to both of our programs, well, that's gotta be more impactful, right? Because they're great. So we've been kind of doing that. I think for me, it's really been this collaborative opportunity that's been really great. And I think we're at a point in time where we have to. Like, there's no way each of our organizations or each of our individual programs can do anything alone to really solve anything.
I alluded to it a little bit earlier, but the idea of reaching out, cold calling an academic partner and just saying like, hey, I have this program. It feels daunting, but it also feels like I need to have a certain type of program to offer them. Something that has a beginning, middle, and end. Something that I think can show a baseline versus completion as opposed to an ongoing program. I really got caught up in those, but we don't do this, even though we're incredibly proud of what we do. And so I think this broke down kind of the assumptions that I had about how I could work together with and collaborate with an academic partner, what I need to bring to the table versus what they'll bring to the table, and understanding that we can figure it could look differently. And also the idea that it doesn't need to, I have maybe one or two programs that I think might have a path of evidence-based results at the end, and I have others that it's impact. And I think it's okay now to talk about those, just what this reflects, instead of always having it be such a thought out process that requires sophistication. So I appreciate that. I mean, Matthew has been a fantastic partner. I just want to say that. And part of it is the iteration that we had. I mean, I had 2 staff that were talking with him all the time and complaining. I mean, but we don't like this, but we don't, that word, that, and those are the things we talk about internally, but like we aired our concerns, don't let them see you sweat was not how this process worked. And he took it all in stride, and he did not think these are not bad partners simply because we were bringing more concern than excitement to the table. We were excited about what was possible, but we were really concerned about how we got there. And I think one of the things that I love about this survey, I'll just say this, is it's applicable to any program we have if we wanted to so use it, but also the column of not applicable. It's not something we've ever done at DeRote, and because it's now something I can use in a number of different programs, I've started to add it in places where I thought it was appropriate, because I don't want to take out questions just because I think they might be not applicable. I want to hear what the constituents think is applicable, and I hope that my staff will learn something from realizing that we're almost like tailoring things too tightly, and opening it up is really exciting.
And I'm just going to add one more thing.
Please.
So yeah, this iteration of coming to this 6-question survey, as Matthew said, 13 was just way too long. The 6. I just want to point out, and I imagine it's relevant for a lot of you, but I know for our programs, we're dealing with a lot of people who are not connected. So this really it's a manual process of individually calling people and doing these surveys over the phone. So even though that may seem kind of silly, the difference between 6 questions or 13 questions, the opportunity was to do either or both of these surveys with our pilots, and my staff voted for the 6 based really on that reasoning that we've got to call everybody individually. So the fact that that was understood and included in the final result was really incredible.
Yeah. Having worked with so many different community partners, I think the main thing to focus on is, of course, what is success? What are you trying to accomplish? And having that conversation. What was unique about this was it was working with 7 or 8 nationally driven partners all at the same time to try to get them to have some sort of consensus or cohesion. And that to me was the most fun, the funnest exercise of them all was, how do I get this group of individuals to relatively agree on what they want to see, giving, they're all speaking about their own programs, their own history, their own client base, but yet we were trying to create something universal. So my main goal was to listen. My main goal was to be flexible. And my main goal was to throw out options that get shot down. And then what about this? And then what about that? And then what about this? And what about that? Because again, I thought we were coming in like, look at this thing, don't you love it? And they're like, nope. And I was like, okay, well, let's go another direction. So, the open communication, the have no shame, no tears, no offense, we're all in this for the right reason to get something done, was phenomenal.
And we all think we do our programs just that much more unique than the next person, right? So like having it all kind of be available for all of us to use in different ways was really the most meaningful part of this, because it applied to all of us.
Mm.
And I'll note that Allie and I weren't in those initial meetings where everyone was fighting with Matthew.
All right, that's great. So, and I like this point that this was a collaboration not just between academia and community organizations or nonprofits, but this was, really thinking as a group, what is important, how can we break down some of these silos between different organizations. So my final question, the foundation has provided a lot of the platform for people to come together. I'm curious what you all think about opportunities for people to participate in these types of processes moving forward. What opportunities are out there?
Oh. there are so many different networks, and I'm sure many of you are parts of them. And specific to this space, the foundation does amazing things, amazing resources, the conference that you spoke about, other ongoing projects. I think about Commit to Connect, if anyone's in the nationwide network of champions, being able to just be a part of something, be vocal, understand what you need, express what you need, what you want, and be able to have that opportunity to hopefully reach out or connect with others to make that happen. So I feel like everybody should just, be open to the conversation, or at least not be afraid to ask. If you need something and something's not working for you, that's where we started. What is available is not working. We need something better. So what do we need to do? And if even this isn't working for you, what's next? I don't know. I don't know where else.
Well, I'm just gonna say, we have these nifty little QR codes on our things. We're at a social connection conference. So meet each other, because everybody in this room, everybody at this conference is a potential partner, collaborator, venting person, anything. We can work together. We're all doing kind of related and interconnected work.
Great. Well, with that, thank you, distinguished panelists. We are open for questions.
Oh, wow.
All right. Can someone help with?
I can microphone around.
Oh, thank you.
Oh, sorry.
I don't know. It was all in unison.
I was lucky enough to be the first question. So these program outcomes are parts of the function as opposed to the structure and quality. I work with a Medicaid population. Medicaid doesn't care about these things. So how do we move from this idea of measuring things that may be impacted by our program to being able to demonstrate results that actually matter to public and private payers?
Excellent, excellent question.
And sorry, just one clarifying question. Can you share with the group the Medicaid or other funders, what do they care about?
A lot of what they care about is reducing costs to the system. So can you reduce hospital usage? Can you get people off of the Medicaid rolls? Medicare is a slightly different setup. I work with adults with serious mental illness, and so it's all about how do we reduce the cost to the system.
Yeah, wonderful point. And the reality is that no single measure is ever going to be the ultimate. And so this is now another tool in the box that can at least start to show the value and make value propositions. So while this may not directly be linked to, return on investment or cost savings or averted service use, it could have, in fact, physical health, like we heard. But the thing is that you would have to actually study that, and you would need to complement that. And this by itself, only being retrospective in nature, naturally we need to understand what the actual longitudinal data or what the repeated measures would show you and link that to the correct data. So it's multiple data sources, multiple data elements collected, and then putting this into context as an and, if that's not the primary focal point.
Yeah, and I'll just add that there are, to build on Matthew's point, this is a great starting point, and there are ways of both linking these survey measures to existing survey measures, the UCLA Loneliness Scale, the Berkman-Symes scale, which are very widely used. There are ways of obtaining self-reported healthcare use. How often have you been hospitalized? How often are you going to the emergency department? And then even linking that to electronic health records. So I think this is a great first start. And yeah, completely hear you that funders care about many different things, and we want to be comprehensive in how we evaluate those things.
Yeah, I'm just going to footstop a little bit of what you said. So I'm in a fellows actually on a Foundation for Social Connection, and I worked it on national payer for 15 years in Medicaid and Medicare, and also with AARP, as we were trying to work on things like how do you help people be more resilient, one of those factors. And so as part of my job as a non-clinician, a non-researcher, was to figure out how to help the leaders understand why this is also important, right? Because they don't really want to listen to preventative yet, unfortunately, but we keep working on that. And so one of the ways in that I would use often is member experience. So they need to build loyalty, they need to build trust, They need to build engagement. And many of these organizations do that to a T. So I'd always kind of start there. And then the health outcomes, you were so right about that. And then Ashwin, to what you said, sometimes you have to start with those self-reported measures, that's great. And then you finally get to the place where you gotta think about, how do I connect to the claims now? And that takes time. But if you can start building the case to get to that point and then they see it, that is like the home run, right? So just some thoughts for you as you're thinking about your programs. That's so critical, and they need it so badly. Just one extra piece to that. Some of the conversations I would have is they would say, yeah, this stuff is never gonna be something payers have to worry about. And I would say, yeah, I remember when social determinants of health first happened, and they said, we're never gonna have to do transportation, never have to do food, never have to do housing. They spend so much time on that. And you know, it's fun to sometimes badmouth payers, but this is a space where they make a huge impact on, right? And so now the next thing is, how do you get them to help us leverage our own personal strengths? So I just have to foot stomp everything that you're saying.
And sorry, one quick point to build on that is it can feel overwhelming to do this all on your own, and that's where these partnerships with academia come in. I'll give you one example. We, when we were working with the Institute on Aging Friendship Line, we built in the Healthy Days measure. So the CDC Healthy Days measure, how many, in the last 30 days, how many days were you mentally?
How many days was your mental health not good?
Yes.
Or how many days was your physical health not good?
Yeah.
Which is mental gymnastics on its own.
Seemingly simple measure. It is tied to healthcare costs, though, so each day that you save is tied to a certain amount of money saved by the insurance company or by the payer, right? So we were able to link that to the program and to some of the other social connection measures. So just to say, there are a lot of creative ways of demonstrating value, and so this is often a conversation that we can have when designing an evaluation plan.
That's great.
Hi, Heather Naraki from AERP. I just wanted to bring up to everybody's attention, I thought I remembered this and I just Googled it. AERP did a study in 2017 that looked at the impact of social isolation on Medicare costs and found that $1,608, that federal Medicare spends an average of $1,608 more on people who are socially isolated. So I encourage you to Google AERP, social isolation, Medicare costs, and it'll pop right up.
That's terrific. I think I cite that study in every talk I give, so hugely important. Thank you for sharing that.
Hi, I'm Wendy Burba, and I have a firm called Belonging by Design. So I work with organizations on creating like a culture and infrastructure for greater belonging. So sometimes it's programmatic, but oftentimes it's really changing how you do things. And a client or a community member may not feel like they wouldn't even know what to respond to. So I'm just curious if the interventions are sort of global, cultural, can you still use this tool because it's really still important to measure those changes?
Thank you so much for that question. One of the things in the larger pilot, so not necessarily with the R-Basic, but with the RACI, we have had the village-to-village model, 3 different ones across the country. So again, more of a community, more of a collection of services, and now how is it that we're saying the it? And so we work to rephrase it to make sure that it matters, because that XXX can be replaced with however it makes sense to your clientele. And so we went back and forth, and we have a few different examples that I'd happily share that make it a little more universally applicable.
I'm Abigail Hoffman from the University of Rochester, and my question is about kind of the theory undergirding this around social connection. When you said moving from the RACI to the R-Basic takes out structure and quality and focuses only on function, and I wondered if you could speak a little bit more about what's essentially reducing social connection to one of its 3 aspects instead of considering all 3.
Yeah. You know, I think that's a wonderful point, and I think it's something that was spoken about by Julianne and Eddie earlier today also, and that is, how many questions do you have to ask to really fully understand social connection or the social deficits that somebody's experiencing? And so with that said, the RACI phenomenally can ask things about structure and function and quality. it's not comprehensive in its own right. It would have to be hundreds of questions, but 13 does that. So that just means that if we've reduced down the R-Basic into only focusing on function, then those are the deficits that we can determine whether or not our initiatives are addressing. Other questions would have to be asked if we were going to address some of the structure or some of the quality of relationships. And so with that said, you get the data that you asked. And so I find that both have great merit. You know, if you're not willing to embed 6 questions, you're not willing to embed 13. So some of this information is great, but a more comprehensive measure like the 13-item RACI might just be a little more, depending on the service. And sometimes we don't exactly know what the service or program does, hence the non-applicable. And so sometimes it's defining what it is that we are doing, what it can do, before we double down on saying we can enhance that, or we can, you know, strengthen what we're doing.
I am not a researcher, I'm going to start by saying that, but it strikes me that when you add in more more of the details that cover the other areas, you lose the opportunity to cover what's prevention, right? It's not what somebody's coming in saying, yes, I have this deficit. It's not an identification of it, or maybe it doesn't even exist yet, but it is, the program is keeping them on a path that allows them to have a good life and to be socially connected. And so I think measuring the program itself, in addition to other measures, allows you to see where you're having an impact, whether it's preventative or responsive.
I'll just add one quick point. As a researcher, I worry about missing out on structure and quality. And I hear that survey burden is a big deal.
It is.
What I've found is that functional aspects of social connections are the easiest to measure. You know, you're asking people, how do they feel? And people can answer that. The structural aspects can get out of control. Like, you're asking, how many relationships do you have? How frequent are those interactions? You know, coming from a background in sociology, you can think about all these complicated social network measures, and same with the quality of relationships. You have to get into those individual relationships often. So I think that this measure is a really nice way to also introduce participants into the idea of evaluating a program. And so this is a great starting point, and I'll be interested to hear how this, you know, we continue to build so that we're not missing out on the potential gains that programs are having in those other domains.
Hey, my name is Holly, and my efforts are to bring the public aware of this, and I think it was Ali mentioning your language and how you compromise between the two. Is there resources to provide insight into that?
I can just tell you kind of what we experienced. I definitely think that being more aware of person-centered trauma-informed care made staff very concerned about using the words loneliness and isolation and how we were talking with people, even though we're hearing it more in doctors' offices and in other environments since COVID. And so I've been talking to researchers, both Matthew and others, about the idea that you do want to design your surveys with the constituents' support and collaboration so that there's buy-in and an appropriate process to how you build your evaluation instruments. But if you were to ask the people, I think, in our programs, if they were participating in our programs for social isolation and loneliness, most of them would say no. They're going to say that it's for, I want to make a friend. It might be that I want a new friend. It's just not an identification of loneliness and isolation. So we responded to that by kind of taking those terms out of the questions we had, because people would say things. They would say, why are you asking about that? That's not why I participate. And it's really not about why they're participating. It's what we're getting out of it and what the impact that we can have that we need to measure. So in talking to some colleagues, I presented that question, like, how would you address this issue? And they said, we would just create an introduction. Some researchers shared, we just share an introduction that explained why it is that we are using this language and that we do not mean to offend in any way, but education might get us over the hurdle of bringing that language back. And We brought that language back in the RACI, and we did get some feedback about it, but overall, not as much as we expected.
Thomas Cujo from Baltimore. Question for you, Matthew, about specifically reminding us of what this tool, the R-Basic, is and what it is not, with a specific lens to think about it being retrospective. And then secondly, if you can talk a little bit about maybe there's people who are focused on people in midlife and youth thinking about this tool in those contexts.
Yeah. Yes, thank you for that. So as with any retrospective measure, what it is an opportunity to collect some information from individuals that may be a little biased based on recall. How long ago did they start this? How long have they been included? So it's not always as accurate because we don't know where they started from. We don't have their own baseline from before starting to get this program in service to where they are now. We just know what they are now, how they feel now. And so it's nice to know that these individuals can feel like the program or the service is benefiting them in these ways. So that's what's unique about this. It's about the program or the service. It's not about how they feel generally. It's not the state of loneliness or the state of disconnection. It's about how this program or service was giving them opportunities to do these things, to what degree. So now to complement that with a pre-test, post-test so that we can actually say, was there a change? That's different. And so that's why complementary, we can add these kinds of measures to now understand what our service did relative to did their overall state of disconnection change. So it's both. But oftentimes organizations don't have that capacity, as we've discussed, so this is a great step. The other thing being, in the RACI pilot, there was also multiple organizations that were serving caregivers, individuals who were volunteers of programs, but also younger populations, even college age. And so universally, depending on what you're using, at least for the RACI, many of these were very, very applicable and universal across sectors, across programs, across clientele and populations.
All right, and with that, I think we're wrapping up for today. But please feel free to reach out if we can be helpful in answering additional questions that have come up, and please connect with your colleagues too. There's a lot to discuss related to this topic. Thanks again.
Thank you. Thank you.